Welcome back to the Colorectal Surgeon. I am Dr. Samrat Jankar. I am colorectal surgeon based at Pune. November month is Piles Awareness Month. This month we are creating daily one video on different aspect of the piles. Today one of the most important thing we are going to discuss is, will piles come again after treatment? This is one of the very common question asked by many of the patient who is on the medical treatment, who get the surgery done. And few of the patient comes to us telling that I have underwent the pile surgery year back. Now again piles has started. Will piles come back again? Very true, honest answer is yes. Even after surgery? Yes. Almost 10 to 15% of the patient even after surgery can have piles once again. Is it means it's a failure of the treatment? Absolutely not. Piles recur because of 2 to 3 main reasons. Most important is the root cause not has been treated. Second is the patient had not properly underwent surgery. Third is not taken proper post-operative care. If you follow your surgeon under whom you are taking a treatment, if he is qualified surgeon, done good surgery, chances of recurrence get down. If you follow the post-operative instruction, properly follow the surgeon at least period of 4 to 6 weeks after the surgery, chances of recurrence of the piles goes down. The most important is root cause not treating might be one of the reason where piles comes again. The most important issue root cause treatment means a constipation. Around 30% of the piles patient are having piles associated with something else, kind of chronic constipation, dysenergic defecation, where the patient eventually going to put the more pressure at the time of defecation to push the motion. Because of the pushing of the motion, again new piles may form, or those piles has been reduced, they start swelling again. The swollen veins will lead to piles formation. The chronic constipation, particularly dysenergic defecation, if you have the habit of sitting longer time in the toilet, hard lumpy stool, sense of incomplete evacuation after the motion, still you feel that there is left over the stool inside the rectum, or you feel that the motion is getting blocked before passing the motion, or you need to put the finger to get the motion out. That is classical of dysenergic defecation. These patients, if you have early grade of piles, in those patients, medical treatment along with proper anal manometry. If there is dysenergic defecation, biofeedback. If there is a large grade pile, surgery followed by recovery, followed by proper manometric evaluation, followed by biofeedback. Those things will help you to avoid recurrence of the piles. In piles, you want to prevent once again piles formation. You need to treat the chronic constipation, increase the fiber intake, adequate water intake, and natural call urge of defecation should not be ignored. Proper toilet habits such as sitting on the Indian toilet or using the potty scotty, making an Indian squatting position for the toilet, or avoiding the straining, avoiding using mobile in the toilet, and avoiding sitting for longer period of the time in the toilet. Those all habit combinedly along with proper treatment under qualified, because what type of surgery in what grade can be assessed better by the qualified person rather than the non-qualified person. And the qualified, that is MBBS MS or MBBS MS and colorectal specialist, you need to visit the qualified surgeon so that they can take a right decision that will prevent further having. In short, surgery cures your problem, but prevention lies with treating the root cause. So friend, piles can come again. There is possibility. It can be prevented by taking care of the root cause for the piles, getting treated under qualified person, and doing the follow-up and preventive aspect what has been told by your surgeon will make foolproof not to have again. Thank you. If you feel our video is added value to you in the knowledge of piles recurrence, in that scenario, like our video, Share this video to someone who is having recurrent piles, and also don't forget to watch our next video on the piles tomorrow, and without forgetting subscribe our channel to see further new videos on this channel, The Colorectal Surgeon. Thank you.